Thank you very much, Patricia. We come to the end of this symposium, but I promised you all there is room for questions, for suggestions, for remarks, and so on. So all the papers are open for discussion now, and if somebody from the speakers wants to comment, they are welcome as well. Who takes the floor? Yes, please, over there.
Thank you. I wanted to ask, having listened very carefully to all the lectures and being very impressed by their content, no one mentioned specifically measurement of impairment. And one of the things I'm struggling with in my practice is an ever-increasing referral rate. More and more children we're being asked to see, and the thing that we need to seem to help with most is educational provision and support for the families. And in order to get the right children quickly to the service, we somehow need to look at impairment. I wonder if there are any comments on that.
Monica? Come over here, please.
If the speakers will come.
Yes, come over.
If everyone sits up here, then.
I'm not sure about the microphone.
At 2 o'clock we had an interesting symposium about the applying ICF, the International Classification of Functioning, Disabilities and Health in Psychiatric Disorders. And I show, for example, some data from this follow-up study and the relationship between Asperger's syndrome, low and high functional autism to different level of functioning and impairments. I think this is a very useful instrument, for example, just to bridge the gap between medical and more teachers and education and so on. Yeah.
A question over there, please.
Thank you very much for very nice presentations for all the speakers. If I can get back to Patricia Howley's last comment, is there much to be gained by looking at the differences in autistic spectrum disorders, Asperger's, and so on? Do we have to differentiate the minutiae between them all? And how good is it going to be for the patient at the end of it? Could somebody give me a clue, please?
Patricia, go ahead.
Okay.
I think for the parents it makes not a very important difference, but it is important if there are, for example, other comorbidities, or if the outcome is very different in the diagnostic groups. But what I always say to the parents is, for your child it is not relevant. It is relevant that this child is autistic or it is not autistic, and what can we do for this child, not the question whether it is Asperger's syndrome or high-functioning autism. Because in Germany the Asperger's syndrome is becoming a very popular diagnosis, and sometimes parents have very mystery imaginations what Asperger's syndrome means.
I think research-wise it's important to try and refine categories as much as possible. It's important for genetic studies and in terms of treatment studies as well. But I think on a day-to-day clinical basis, it's stressing that these children all have in common the core problems associated with autism, and also making very clear to educationalists that having Asperger's syndrome is not a mild form of autism. It's a form of autism in which in which cognitive ability may be only mildly affected, but the impact of the social difficulties, the communication difficulties, and the ritualistic patterns of behaviour may be just as devastating, sometimes even more so, in a high ability child as a low ability child. And there is this, certainly in the UK, tendency to see Asperger's syndrome as something that's not that important really, and you don't need to put any special educational effort in. So sometimes that diagnosis can do children a disservice rather than a service. So I think one has to be quite careful in terms of making a diagnosis, and it is important to know what the local culture is concerning the use of different terms, because otherwise it can actually prevent children getting the help they need if one uses a term that people don't understand or misinterpret.
Any more questions or suggestions? Laura, take the microphone.
My question or my suggestion is to include in your sample of subjects also subjects with ADHD, and to differentiate as for attention, tasks and inhibition problems, because also these groups show very striking results in this field, and I think this is necessary to see whether this is a specific problem of MCDD or for other patients groups.
It's an important question, because what I didn't mention in my talk, that the group...
I think nearer to the microphone.
Okay. The PDD group as a whole has a lot of problems on attention. So if you compare them to the ADHD group, which we did, but I didn't present it, they have attention problems that are much the same as in the ADHD group. It was not my mission to try to find a subgroup with a specific profile, but it was my mission to find risk factors that predict outcome, perhaps not as a risk factor very specifically, but I think in combination with other risk factors. So I think it's an additional risk in a group of children with already a lot of these signs, like you mentioned, of autism and social dysfunctioning. And I think this might be an additional risk within this group. But actually, when you compare their inhibition problems and attention problems to ADHD, they're quite the same. So much disturbance. Yeah.
Other questions?
I think everybody's tired.
Then I think we have come to an end of a very fruitful, interesting and symposium with a big variation of subjects. I thank the speakers, and I thank my co-chair for giving the comments. I thank the audience for their attention, and till next time. Goodbye.